Hello everybody, my name is Shireen Abu Elhija. I am from Israel, Haifa Bnei Zion Hospital City Center. So it's my thesis and I make it with my supervisor, Professor Ifrat Dagan, Dr. Orit Kastel and Dr. Matthias Karlibach. My thesis took about self-stigma among patients with hepatitis B and C and its association with delayed diagnosis and treatment. The background about that thesis. Stigma is one of the main issues that patients with hepatitis cope with. Hepatitis is linked to stigma because of disease transmission routes. Mainly hepatitis, drug abuse, or unsafe sex that are perceived to characters a group of people who are not well accepted in society. Such stigma may cause serious psychological, social, economic, and even health-related repercussions. Mainly diagnosis and referral to treatment is the ultimate importance for hepatitis patients in order to prevent disease progressive and complication and improve quality of life and prevent further transmission of the disease. The main of that study to investigate the association between perceived self-stigma in patients with hepatitis B and C, the stage of the disease at diagnosis, and the time lag between diagnosis and the first visit to a liver clinic. Here the study model, the background variables, the socio-demographic variables, age, gender, religiosity, education, and the clinical variables that we took from the record from our patients, and it's took about type of the diseases, if it's hepatitis B or C, stage of disease, and we take the fibrosis degree of our patients and familial history if they have anyone related to our patient that he also have the same disease of hepatitis B or C, and how it's affect to self-stigma and how is the variables, the background variables and the self-stigma related to stage of the disease and the time lag between diagnosis and the first visit to liver clinic. We make it in our hospital. It's a cross-section study. Was conducted among patients who carries hepatitis, who are following in our clinic, or he is take a treatment in our liver clinic in Bnei Zion Hospital in north of Israel, in Haifa. Eligible patient was asked to complete a set of questionnaires. There is two questionnaires. The first one, they have to fill socio-demographic variables, and another questionnaire, it's adapted from Dorothy Lee, and it's a self-stigma question. It's something like it's 20 questions about self-stigma and how they think about people who, what are they thinking about people who have hepatitis. The result of that study enrolled this study were 120 patients or carriers, or they have or treatment from with hepatitis B and C. The table 1, we see the socio-demographic variables and the clinical variables. I will take the must thing that we want to talk about it. Approximately 3/3 of our patient was with hepatitis B, 65%. The main age was 55.3, and the majority was female. It's 60%. Half of our patients with hepatitis B have a family history, and just 12% of hepatitis B have a family history. Main lag time between the first diagnosis of the disease until visit to the liver was to the liver clinic was for a 41.07 months. It's the main of all our patients. Patients with hepatitis B reporting significantly higher level of self-stigma than patients with hepatitis B. So we see that people with hepatitis B feel more self-stigma. That is we can see the table of the regression model, and we find that self-stigma and the age at diagnosis are the predictor to a disease stage. So we can see that people with higher age feel also people who have more self-stigma are coming with a stage of higher stage of the disease with more fibrosis. A conclusion: self-stigma is the factor that inhibits diagnosis. Therefore, their patients are diagnosed in later stages of the disease. Our findings shows that patients with hepatitis B, adult and advanced stages of the disease continues to target patients to intensive screening, intervention, and access to medical care. As a result, we may prevent infection and reduce spread of disease. Thank you for hearing me.